When a patient decides to undergo CAR T cell therapy, a care partner is generally required. Why is the care partner crucial to the process?
Yes, so a care partner is absolutely essential to the CAR T cell therapy process. And the most important reason for that is because close monitoring for serious side effects is required. So after the CAR T cell infusion, patients are at high risk for acute complications, including cytokine release syndrome, acute neurotoxicity, and infections. So these can develop pretty rapidly. So it's vital to have someone present who can recognize early warning signs and seek medical help right away. Fortunately, with the FDA's recent update, reducing the post-infusion driving restrictions and proximity requirement at the CAR T Medical Center from 4 to 2 weeks, this aspect of care may become more manageable for both patients and caregivers, because it's really hard sometimes, and we've seen this in clinic many times, for both patients and caregivers to just take 4 weeks off from their daily routine, including work. Now it dropped to 2 weeks. That might be much more feasible.
How can patients and care partners be best prepared to manage the issues that may arise?
This is a great question. And here I think that education before treatment is super important. So patients and caregivers should attend all the pre-treatment education sessions offered by their care team, where they really learn about the most common side effects, what symptoms to watch for, and when to seek help. Also, I always say to patients, ask questions. No concern is too small. It's also important to know the emergency plan. Patients need to make sure that they know exactly who to call and when, if symptoms occur, day or night, because it's just sometimes different what they should do during the day, where things are easier, or during the night, things might be more challenging. We ask patients to monitor themselves daily at home, to take their temperature, and for the caregivers to monitor the patient alertness and behavior pretty closely, especially for the first 2 to 3 weeks post-infusion, and write down the symptoms in much detail, and ask questions during follow-up visits. I think it's also very important to understand the medications and the restrictions. So it's important to follow all the instructions regarding prophylactic antibiotics or anti-seizure drugs, because the last thing we need is to have an unnecessary toxicity happening because a patient forgot to take their prophylactic medications. And then I think overall, I always tell patients, trust the process. You have a whole care team with you to help you and navigate you through this journey. And I think it's just important for caregivers, to create a safe and supportive environment at home. So I always say, plan for rest, hydration, and good nutrition. Limit the amount of visitors to avoid any infectious exposures during the recovery period. And of course, ask for help, from friends or family, so the primary caregiver doesn't get overwhelmed, because we've seen this as well. Like being a dedicated 24-hour caregiver, it's pretty overwhelming.